ఇది పంపించినాయి రేపు పంపించినాయి హలో 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 Yes, get ready, everyone. Yes, the listening subtest. The listening subtest. So regarding the listening subtest, this is called oral skill and receptive skill. Oral, receptive. Oral means there are two types of skills. One is written skill and one is oral skill. So there are two written skills and there are two oral skills. Written skills means which you write. That is writing and reading. They are called written skills. Listening and speaking are called oral skills because you use your mouth to utter the words. Oral skills and written skills. Fine. Now, okay, the next one is productive skills and receptive skills. Productive skills means you produce, okay, that is writing and speaking. You produce words, you produce grammar, you produce vocabulary, okay. So all these things, that is called productive skills. And in speaking, you pronounce the words, pronunciation. So productive skills. And then receptive skills. Receptive skills means you are not active participant. Okay, when somebody is active, you are listening or you are reading. That's all. So these are called receptive skills. Somebody writes, you read. Somebody speaks, you listen. These are receptive skills. So questions. Now let us see. The listening subtest is the first test in the OET examination. So only after listening, you will have reading and then you will have writing and finally speaking that same day or the next day. So listening, reading, writing and speaking. This is the way it goes. Now, in listening, there are three parts. There are three parts in the OET listening subtest. Part A, Part B, and Part C. Three parts. Part A is the easiest. Part B is the average. And Part C is the toughest. So increasing difficulty. A is gear 1, B is gear 3, C is gear 5. So the fastest. Power also is vocabulary also powerful in C. Okay, more of C1 and C2 vocabulary will be there in C. More of B grade vocabulary will be there in B. More of A level, A1, A2 vocabulary will be there in A. B1, B2 will be there in B. C1, C2 grade means very strong vocabulary will be there. Now, questions. There are altogether 42 questions in the official OET. 42 questions. So part A has 24 questions. Part B has 6 questions. Part C has 12 questions. So 24 plus 6, 30. 30 plus 12, 42 questions. Only 12 questions are there in part C, but they are the toughest. The toughest. So you have to concentrate more on the vocabulary there. Otherwise, it will be very difficult for you. Test duration. The listening subtest lasts for around 40 minutes. So roughly 40 minutes. It doesn't mean exactly 40 minutes. It may be 35 or 40 or 45 like that. So approximately 40 minutes. Now you have the audio recordings. You hear each recording once only. That means you cannot hear again. So once it is lost forever. So the recordings will not be repeated. Therefore, you have to be very careful. You have to apply the focus, attention, and concentration techniques. These are very important. I'll teach you later in the next stages. Now, practical approach. 3 separate parts in the listening test. Be prepared for the test day and familiarize with the format of each part. Now, what does this mean? So, 3 parts have 3 orientations. The first one will check about specific information. The first one will be checking about the specific information. That means he will be expecting something and you have to provide that thing to him. That means whether you are able to catch the words properly or not, the information appropriately or not, in time or not, whether you are presenting them properly in the appropriate required format, for example, adjective or verb or noun. What is required that you have to provide. And then be prepared for the test day. Be prepared before the test day. On the test day, it will be very difficult. So before only you learn the system, the tradition, the style, okay, how many questions, what questions demand, and what type of answers you have to write, whether it is single, one word or 2 words, whether you have to write a word or a phrase, okay, whether you have to write singular or plural, okay, or a common noun or proper noun, what exactly it is asking you have to find out and you have to be ready. Okay, what questions ask, for example, how many different types of questions are there, how many fill in the blanks are there, how many multiple choice questions are there, okay, each how many sections are there, and each section how many extracts are there, and in each extract how many questions are there. Everything should be fixed in your mind without any doubt. Now, content. All of the listening content is appropriate for healthcare professionals. Yes, sir. Yes. Hello, Regimol. Hello. Hello, Reggie. Sibi. Cinemol. Any one of you can unmute. Are you able to listen to my voice? Okay.
Yes, sir, it is audible.
Yes, yes. Okay, fine, fine. Okay, that's clear. Thank you. So here, all of the listening tests, all of the listening content. Now, what do you mean by content? Content means subject. Subject means information or data is appropriate for healthcare professionals. So all of the listening content is appropriate for healthcare professionals. That means every information, every sentence, every word, every style, every structure is related to healthcare professionals. So everyone can understand it is not out of the subject. Everyone's common subject will be there. And in all the 12 different professions, so all the 12 different professions, people who are writing all the different, for example, nursing, medicine, podiatry, physiotherapy, like this, all 12 different professions, whatever profession you do, all these are common. Listening is common. That means it is common for every professional. Only writing and speaking are different. They are relevant to their particular subjects. But listening and speaking are common to all the professions. Commonality. What is common? The listening subtest does not require specialist knowledge in any particular healthcare field. Now here, this is very clear. Oh, it is very difficult for us. We cannot understand. It's beyond our understanding. No, no, no. This is common. They don't require specialist knowledge in any particular field because they are not asking questions related to any special thing which cannot be understood by you. They're asking common things. For example, they will ask body parts, they'll ask regarding the medications, they'll ask regarding the treatment, they'll ask regarding the name of some drug or something like that. Okay, or how much blood pressure, what is the age, okay, when was that, okay, all these things they will ask. They will not ask any specific medical subject there. They will not ask any particular medical subject. They'll ask you only about English. Okay. They'll not ask you any specific medical knowledge or terminology. They'll ask general things which any common person can understand. Not only medical person, anybody can understand. Like that they will ask. The listening content tests the candidate's level of English language proficiency in a healthcare specific environment. Many people think people who know medical knowledge, they only can teach OET. But no, sorry, you are mistaken. This is not medical test. This is an English language proficiency test. Okay, occupational English test, not occupational medical test. It is occupational English test. That means English in the medical area. So that's all. They're not testing how much knowledge you have in the medical field, but they're actually testing how much English knowledge you have related to the medical field. That's it. So be very careful here. The listening content tests the candidate's level of English language proficiency in a healthcare specific environment. That means if you are working as a medical professional, you have to learn these things and you have to know these things. Otherwise, it will be difficult for you to manage those conditions appropriately. That's why it is very important that you learn all these things beforehand. Suddenly you go into exam and you don't know. It should not be like that. So learn everything here and be perfect in English and then go for the exam and you will definitely pass. If you try for passing the exam, definitely you cannot pass. But if you try to learn the language, definitely not only language, but also passing is easy. Next, analysis. Now let us study the three parts of the listening subtest separately. We'll first study the three parts of the listening test separately. So part A first, part B next, and part C last. Fine. Part A. Now in part A, there are two different consultations. That means consultation 1 and consultation 2. Part A is subdivided into two subparts. That is consultation 1 and consultation 2. Audio 1 and audio 2. Consultation 1 will be some medical professional, consultation 2 will be another medical professional. So here, based on the consultation, the subject will change. For example, if it is a cardiologist, subject will be related to heart. If it is a pulmonologist, subject will be related to the lungs. If it is ophthalmologist, subject will be related to the eyes. If it is, bone specialist, okay, so it will be something related to bones, right? So you have to understand what professional related to that one. For example, ENT, okay, ENT specialist. So it will be related to that. If it is a veterinary doctor, it will be related to animals. So like that. If it is a nurse, then it will be regarding nursing. So in this way, the person who is involved there, who is giving the speech, who is talking, the subject will be related to his subject area, his specialization. For example, physiotherapist will talk about physiotherapy and movement of movement of limbs and body parts. So how treatment is to begin. So those only he will talk. And if it is an ophthalmologist or an eye specialist, okay, he will talk only about eyes and vision and power and why it is problem. So all these things he will discuss. If it is nurse, the subject will be nursing, and it will be talking about giving him medication or injections or treatment or something else, management. Fine. All these things will be given. So two different consultations to understand two different situations. Now consultations. In each consultation, a healthcare professional is talking to a patient. So one is the authority and the other one is a person who gets knowledge from the professional. So in this consultation, it's a meeting place between a professional and an ordinary patient. So they will discuss about what all the problems will be. So there may be different styles. It may be at home, it may be at the clinic, it may be in the hospital, it may be in a meeting room, or it may be in the some other setting, okay, like ward or somewhere else, emergency room, anything it may be. So consultation is consultation wherever it is. Fine. So the healthcare professional is talking to a patient about his problems, medications, diet, disease, then solutions, then treatment, management plan, exercises, and many other things. For example, daily dressing, then walking, or then okay, fine, regular monitoring of his activities, medication compliance or medication non-compliance, dietary compliance or non-compliance, all these things will be discussed. Next, in each consultation, there is one note completion activity. So there is one note completion. That means it is a notes. And in the notes, there is incomplete information. That means 100% is not there. Something is missing. And you have to listen to the audio and you have to write the same words without changing the format. And you can change the format also, but it should fit according to the sentence. When you hear an adjective, maybe in the sentence adjective will not come, verb will come. Then you have to use the verb or a noun or something like that. So whatever word you use, that word only you have to use, but you can change it form to fit in the sentence. For example, clever is there. So all his answers, he gave clever answers. He gave clever answers. You hear in the audio, but the same answer you will not hear here. He'll give like this one. He answered dash. He answered dash. So here he answered clever is wrong. He gave clever answers, that is correct. But he answered clever is wrong. He answered cleverly. Ly you have to add, because it is coming after a verb. Before a noun, he gave clever answers. It is a noun, and before a noun, there is an adjective. He gave clever answers. But here he answered cleverly. After a verb, it should be an adverb. So these are the things you have to keep in mind when you are writing the answer. The same word as it is, you cannot put. Sometimes there may be changes, sometimes maybe there may be as it is. So what the words you hear, those words only you are supposed to write, but you can change the word form if necessary to fit in the sentence. If it already fits, no need to change. If it doesn't fit, you have to make it set. So there will be 2 consultations, and in each consultation there are 12 fill in the blanks. So if you are putting 12 fill in the blanks, then automatically 2 consultations will be 24 questions, and each consultation will be broken into sub areas again. Okay, so for example, problems, medication, treatment, okay, suggestions or activities, something like that they'll get. Now duration means time. The part A lasts around 10 minutes. 10 minutes. So each consultation is around 5 minutes. 5 plus 5, 10 minutes. So within 10 minutes, you will finish part A. That means it's very fast. So in 5 minutes, you have to write 12 answers. 5 minutes, you have to write 12 answers. That means you try to understand it is less than 30 seconds, one question. So 30 seconds, if you take 10 questions, then 2 more questions are remaining. So less than 30 seconds, you have maybe 25 or 20 seconds, you have to finish one answer. That is it. Next, assessment. Part A tests the ability to understand and record specific information about the patients. So specific information, for example, doctor suggested him some medication. So you cannot write medication. Medication is not a specific, it is general, normal information. What medication is it? Is it, okay, is it, right? What specific information you have to give, not general information. He suggested exercises. What exercises? Then another question. So that is called specific information, particular exercises. What is it? Range of motion exercises, like that. Doctor advised, doctor recommended exercises. Then again you'll ask, what exercises? The particular exercises, that is the range of motion exercises or stretching and strengthening exercises. So like this one, you have to know what he's telling, what particularly information. When, for example, you go and see somebody and you cannot call him boy or girl, they'll get upset. Okay. So if you call somebody boy, you know his name, his name is David, and you call him boy, he'll get upset. You know my name, why don't you call David? Why are you calling me boy? I have a name, he will say. That is called specific name. Boy is a general name. In the same way, medication is a common or general name. And any particular medication, okay, they are called specific names, right? Particular information is needed, not general information. Part B. There are 6 different extracts. There are 6 different extracts. So all are separate. They are not combined. So one question for each extract, and there will be 3 options. You'll hear some information. The data will come through the audio, and you have to select the correct answer. And before you hear the audio, you will have some time to read the question and be ready, so that when the audio comes, you can find out the answer and write it. So pre-listening time will be there. Pre-listening time. And in that time, before the beep sound comes, you have time to read the questions. And after the beep, there will be the audio, and you have to listen, and then you have to answer the question. And these are from various situations. These are from various situations at the workplace. For example, one may be related to ward, in the ward. Another may be in the training hall. Another may be where charging is transferred. The charge is transferred to the day duty nurse is transferring the charge or the responsibility to the night shift nurse. So that is how it is. Or a senior nurse is training a junior nurse. So like that. Next one, it may be a doctor giving directions to the nurses, or it may be a cardiologist giving suggestions to an apprentice. So like that, there may be a different situation. It may be a consultation, it may be a discussion, it may be anything. So it will be, you notice here, one particular this thing will be there, and mostly they will be monologues. Mostly they will be monologues. And then what do you mean by monologues? One person speaking, one person speaking, and they will be explaining everything. So that you have to understand what it is, why he is talking, what is his intention, what is his aim or objective, what is the cause and effect. These type of questions will come there, and you have to study based on these points only. They are not, you're not just finding some answer. On what basis he is asking the question, you have to question the question itself. Always question the question, then you'll get the answer. If you just try to find the answer, you'll not get the answer. Now, extracts. In each extract, you hear healthcare professionals either talking to each other or to a patient. So now, try to understand here. So there are 6 extracts. So in each extract, you hear a healthcare professional either talking to each other or talking to a patient. So he's talking to somebody. He's talking to somebody, or it may be, mostly it will be single, but sometimes it may be, so they talk to each other. Okay, in this second one, maybe, say for example, it may be unidirectional, one directional. So he's telling somebody, okay, or they are discussing something. Right, now let us see. It may be a professional to another professional, or it may be a professional to the patient. Okay. There is one multiple choice question to answer regarding each extract. So 6 extracts, 6 questions and multiple choice questions. And there will be 3 choices and only one choice is the right one. And there will always be traps to mislead you or misguide you or cheat you. So be careful of those traps. Now part B lasts around 10 minutes. 10 minutes. So that means each question will be less than 2 minutes. So 6 questions. So it may be around 45 minutes, suppose 40 to 45 minutes. Sorry, 1 minute 40 seconds. 1 minute 40 seconds it may be. So like that you can assume. So within that one you will finish one extract and you move on to the next extract. So first there will be pre-listening, that means silence. You'll read and you'll be ready. And when the audio plays, you have to answer the question. So 10 minutes, 6 questions. If you want these points afterwards, you can go to classical corrections I have posted there and you can take from there. Next. Now, assessment. Assessment. First one, this exam tests the ability to understand how well you are understanding to get in the subject, how well you are able to digest the information. So that is what is, this makes an assessment. If you can understand everything they are telling, then definitely you can give the correct answer. If you do not understand, that means you'll give the wrong answer. That means your English is not excellent. Next one, everyday workplace interaction. So it assesses, okay, it assesses the ability to understand everyday workplace interaction. So in your workplace, you meet other people and you discuss many other things. You discuss many other things. So that is how it is going to be. That is how it is going to be. So be careful and try to understand how the discussions will be and what they are expecting and how well you have to pass on the information or how well you have to receive the information. Now, part C. Part C. You hear two longer recordings. So long ones, not short ones. Earlier they are short ones. Here you hear longer one, and each extract will have 6 questions. Oral passages. Those are written passages in reading. Here oral passages in listening. So you hear two longer recordings, which is subdivided into 6 parts. And each part will have one question. And you have to answer these questions. They will be continuous. So you have to decide when it is moving to the new question, because it goes on without any stop. So you will not know when the question is shifting. You will not have any idea. So that's going to be very difficult for you. So you have to assess and you have to guess and where the question is moving, and you have to move ahead with the listening. So for that one, you have to do proper skimming and scanning. Each recording is either an interview or a workplace presentation on a topic related to healthcare. Now, what is an interview and what is workplace presentation? Interview means there will be two people. A person will be asking questions. So he is interviewing the professional. So the professional will be giving answer. For example, I don't know, the people don't know about diabetes. It will be an interview, okay, like a video reporter or a news reporter or a medical professional or somebody else is interviewing him, or a nurse interviewing a doctor. So like this one, to find out information regarding the subject. So they will ask questions. Doctor, what is this problem? Why are people not able to understand that they are affected by this disease? Then the doctor will tell, yeah, there are no signs and symptoms. If there are any signs and symptoms, they can understand very easily. But these signs and symptoms come very late. For example, in asbestosis, after 25 to 40 years, their symptoms come, or they will be revealed. Till then, they're silently inside the lungs, destroying the lung, okay, cells. So like that. So he'll be explaining like that. So you'll be asking question and he'll be explaining the situation like that. You'll be asking maybe 6 questions. So 6 questions they will ask and 6 answers they will give. So that is, if this is an interview, it is very easy to identify, because the question asking person will be a female and the answer providing person will be a male, or a question asking person will be a male and the answering authority will be a female. So because of the voice gender change in the voice, so you can identify very easily in part C if it is an interview. But what about if it is a presentation? Presentation will go on continuously and you have to be very careful, because many people don't understand in the presentation when the question is shifting to the next question, when the paragraph is shifting to the next question. So it will be very difficult. So be very careful with regard to presentation. Presentation is a fatal flaw. You will be facing a lot of difficulty. The question will already move forward and you will still be in the same question. So be careful in the presentation. So try to do more presentation style questions. And when you are doing, identify how the question is shifting. For example, he himself will talk. There is no person change or gender change. So what he will do is, he will tell, now let us talk about medication. Then he will tell about medication and other things. Then afterwards he will tell, Let us take the diet related to this problem. Then he'll talk about diet. Then again, he will change to exercises which are necessary for this, treatment. So then he'll talk about exercises. Then afterwards, he will tell one person faced this problem and he will tell about him. So that one person comes, that is another one. So like that, different topics will be rolling down. 6 topics will be rolling down, and he will be guiding you. He'll give an introduction. He'll give an introduction to that subject, oral paragraph. He'll say, now I will tell you about the causes of this. Okay, there are many reasons why a person gets corona. People don't use masks, and that is the reason, one reason. And they they shake hands, and these fingers, they will touch their nose or mouth, then they will get this problem. So like this, these are the causes. Then treatment. Now let us discuss about the treatment. There is no guaranteed treatment for this corona. Only you have to take precaution, but there are some precautionary measures. So you can take vaccine. A vaccinated person is less affected by corona. If he is not vaccinated, the problem is little serious and it may result in death also. Okay, but a vaccinated person, the power of the corona will be disintegrated or deteriorated or minimized, and therefore it causes less damage or less harm to the person. So this is how he will tell about the treatment. Then prevention. Then he will tell so how to take, how to follow the distance, maintain something like that. So topic changes. And next one, he'll say the government policies regarding this one. Okay, government policy. Government is providing free vaccination drives throughout the country. And this is related to adults now. For the children, they did not start giving vaccines yet. Maybe in the future. So this is regarding adult vaccination. So next in paragraph, they'll say children are not that much affected by this disease pandemic. Okay, so maybe in the future it may affect the children. So that time they will give vaccination for the children also. So another topic change, that is children. So like this, topic will roll and change. The gear will change. Okay, it will take a turn. Okay, not a U-turn, but it'll take a side turn and go straight. Then again side turn, left, right, like that. They will be turning. Okay, again until the corner comes, it will go straight. Then suddenly another twist. That means now let us tell about advantages of taking precautions. So he'll take advantages of taking precautions. Then he'll say disadvantages of not taking precaution. So advantages came, then disadvantages came. Okay. So this is how. Then the impact on the society. So 6th point will be impact on the society, how society is affected. Okay. So how human relations have improved a little and sometimes deteriorated a little. So sometimes family bondage, because everyone is in the house, the family relations improve to some extent. But in some houses, they fight more. So family relations have affected a two-dimensional. Some families became better, some families became bitter. So because every time they're in the house, they don't know what to do, so they always fight. Sometimes, they share their love together. So this is different. It depends on person, place, time, and so like these topics will be changing. So be careful regarding the presentation. Okay. Thank you. I really needed this water. My throat was becoming dry. You're a real sweet little child. Thank you. Okay. I don't know whether how far you understood. I was going on telling. Let me check out. Let me check. Oof. Regimol. Cinemol.
Yes, sir.
Regimol, are you able to listen to my voice clearly?
Yes, yes.
Yeah, are you able to understand my words?
Yes.
My explanation?
Yes.
Okay, fine. Cinemol. Is my explanation clear?
Yes, sir. Clear, sir.
Okay, fine. Who is this? Greta. Is the screen clear, Greta?
Yes, sir.
Okay, fine. Is my voice audible? Okay, fine. Right. Now, okay. Right. Next question. There are 6 multiple choice questions to answer about each recording. There are 2 recordings in part C. So 6 multiple choice questions will be there and you have to answer, and this information regarding each recording, specific recording. And you have to be very careful and you have to identify how it is moving or shifting from one question to the another question. Right. I already told you this. Then next. This part lasts around 15 minutes. So 7.5 minutes each. 7.5 minutes each. Okay. 7.5 minutes approximately. So first one 10 minutes, second one 10 minutes, and third one 15 minutes. 10 plus 10, 20 plus 15, 35. So approximately 40 minutes. Okay, because you have to checking 2 minutes time and writing the name and other things 1 or 2 minutes like that. Lot of things are there. So 40 minutes will be there for the listening test. So this part lasts for 15 minutes and 7.5 minutes each. And in that, each question will be something around 1.5 minutes. 1.5 minute. Oh, sorry. Now, part C tests. What does it test? Part C tests the ability to understand. Part C tests the ability to understand the speaker's ideas and experiences related to the topic. It is not asking just information. What is the idea? Why is he telling? What is his goal? What is his ambition? Okay. What he is going to achieve? Is it true or false? Okay. So what is the difference between the past and present? What are the causes and what are the effects? What is the impact on the society? So these are the speaker's ideas and experiences he is going to related to the topic. Instructions. Now, before each recording, you hear information about the context and instructions about what you have to do. Now, you have the recording, and before the recording of all the test, he will tell you everything. First, take part A. Before starting the test, everything related to test. Before starting part A, he will tell about part A. Before starting extract 1, he will tell about extract 1. You now hear a physiotherapist talking to some patient named Clara Jones, like that. He will give you information regarding who is talking, to whom he is talking, and related to what he is talking, like that he will tell. And who is the patient and who is the professional, all these things he will tell before the extract start, before the recording starts. And you have to listen to them. After that, you hear information about the context and instruction about what you have to do. Now, he will tell you, now you have to fill in the blanks. You have to select one question, the correct answer, okay, and circle the answer, okay, with black and the answer, shade the circle black. So that is what he will tell you. These are called instructions. This information will also be printed on your test paper. What information is coming, what instructions are coming, they will be speaking, and that will also be in the answer sheet, question paper. So there itself it is written everything. So you can listen and you can read also. So it is double dose. It is double dose. One teacher is telling be careful from the audio, and the teacher is telling do like this from the text. So both are important. Any one you catch, you will get the ability to answer. Otherwise, if you ignore both, then it will be difficult for you. So listen very carefully, or read, at least read very carefully, printed directions and oral directions. Now, pre-listening. Before each recording, you have time to read through the questions. He'll tell you. Now you have some time to look at questions 1 to 12. Or you have, before the beep sounds, you can go through the question. So like that. So in that pre-listening time, you have to read. Don't see here and there. Many people see here and there. What you have to do is you have to read the question and underline the keywords, and you can underline the keywords, and you have to circle the operating words. I'll teach you how to underline the keywords and how to circle the operating words. I'll tell you later when I start explaining. Now guess. Now, for example, think about what you are going to hear before you answer the questions, before the audio starts, before you answer the questions, before you listen to anything, you just have the question paper in front of you. So underline the keywords and guess what is he expecting. He answered, he told, he prescribed. Prescribed means some medication. So what medication? This is what problem? This is arthritis. So what medication may be there? Right. This is hypertension. So what medication is there? So like that you can guess. Okay. So based on the situation, you have to build. This is called brainstorming. Brainstorming is very important. You have to break your brain or blast your brain with a dynamite. That is called wisdom. Wisdom is the dynamite with which you break your brains or blast your brains to bring or generate ideas. Okay, so if you guess, you can get the answers. Don't just depend on the audio, because your brain is more powerful, and when you start thinking like that, then you'll get an idea what might be the answers, and you'll be listening for them only. If you don't think like this, then you start listening everything and you'll end in nothing. Okay, so be careful. Yes, ma'am. Yeah. Yes, you can unmute now. Okay. You can unmute now. This is a listening session. Okay. So here we are. Right. The listening test. Okay. Now let us discuss the points. Cinemol.
Yes, sir.
Did you get any new information?
Yes, sir. Information about the part A and part B and part C, and the strategies to apply was a new information for me.
Okay, fine. That's good. Deepti?
Yes, sir.
Yes, Deepti. What is your say regarding the session?
It's very useful, sir.
Huh?
Very useful.
So you got some quality points or no?
Yes, sir. Yes, sir. Yes, sir.
At
I
least
got
one,
some
at least one
strategies.
point.
Yes, sir. Definitely, I got.
Okay, can you share 1 or 2 points which you got? Something new you learned?
Yes, sir. Before I got some strategies regarding part C. Before reading and before listening the audio, also we can find out some points in my through using wisdom.
Very good, very good. Then Evelyn Susan. Evelyn Susan. Okay. Linda. Linda. Yes, Linda. Is this Ezura Linda from Nigeria?
Yes, sir.
Hello, dear. How are you?
I'm fine, sir. Thank you.
Yeah, was the session beneficial for you?
I'm not really getting, I'm just listening to the lecture for the first time.
Okay.
So-
Did you get any idea regarding this?
Yes, I got.
Okay, fine, fine. So when we do the listening test, it will be easy for you. Right. Next. Okay. Reggie Mole. Reggie Mole. Hello, Reggie. Anybody else? Okay, fine. Right. If there is nobody to speak, then we'll stop this session, and within short, we'll go into reading. Yes, Sibi. Sibi.
Yes, sir. Yes, sir. Before I was thinking few words what to write, like as you said, cleverly, like that. It was difficult for me to understand what I have to write because the audio is telling something and the question task is expecting something else.
Yeah, of course.
I mean, the word forms, that's a new information for me because at times I was stuck with the question because it was, I was hearing to something else and I was supposed to write something else as the word format says.
Yeah, of course, of course. Yeah.
So that's a good
Mary
information
Anushya.
for me.
Yeah. Okay, fine, fine. Okay. Mary Anushya. Where is Mary Anushya? Okay, Mary Anushya has no mic. Huh? Okay. Okay. Malika. Hello, Malika. Hello, Malika. Okay, fine. Right. Okay. Very good. So now this is regarding listening. Listening. So I am going to break this and I will send you another link in 10 minutes. And we are starting reading. We are starting reading. We are going to start reading. Yes. So get ready. 10 minutes. If you want to have some tea or something, you can get ready. After 10 minutes, I'll send you the link straight away. And within 10 minutes, you have to join.